Hey, folks. Hi, and good evening. You're all very welcome here. Nice to meet you all. I'm just going to give it a little while before we actually start. So if you're here, if you're in the chat, feel free to say hi. I think the chat is working, so thank you for being here. I'll just give it just a second, just to make sure everybody attends. Hopefully everything is working. I'll let you into a little secret. This is my first live that I'm doing, so bear with me if anything goes wrong. This talk is going to be about how to get the most out of your surgical placement. It's primarily aimed at medical students and young doctors, but mostly medical students. And this is going to be sort of a fairly interactive session, and I hope we can all kind of benefit from it. And it's going to be available for replay on my YouTube channel in the live section. So nice to see everybody here. Feel free to say hi in the chat. And let's just get started. I think that's probably the best thing. So my name is Amir Katapchi. You might be wondering, who is this guy and why should I bother listening to him for a short while, maybe an hour or so, probably a little bit less. But I'm a consultant surgeon at Alton Gelvin Hospital. And I've been there for about over a decade now. It's a long story how I ended up here, but we won't go into that. Essentially, I'm also an honorary senior lecturer at the two local medical schools, so at Queen's and at Magee. Here's me doing some interviews at Queen's, which is so for prospective medical students, and also do a fair bit of teaching and examining and interviewing and other things also at Magee. Here I am doing some, we have a very successful annual surgical study day, which is usually a great success. And here's me doing some hand tying teaching to students. Yeah, so I've actually been involved from the very early stages of at this new medical school at Magee. I also happen to be an MRCS examiner at the Royal College, but that's a bit postgraduate. We won't need to worry about that too much here. But above all, I just have years and years of clinical experience at the coalface, teaching, examining, interviewing, what have you. And I was just looking for a photograph of myself doing some teaching from years ago, and I only could go as far as 2006. This was in the doctor's mess in my old hospital, just before giving a sort of tutorial to some students. And I just struck me that these were the days before online. The computer in the background was running on Windows XP. There were no smartphones. This was a year before the iPhone came out. There were no smartwatches. You guys are very lucky, actually. It's a very good time to be a medical student, because you can literally whip out your phone and actually speak to ChatGPT, and it will give you pretty much everything you need to know. There are some other students here. Nice to see you all, guys. So we're just going to make this a little bit interactive. I'm going to share my screen in a minute. And I'd like you to please go to, if you're on your laptop, please open another browser tab and go to menti.com. Or if you're on your also on your laptop, you can also use your phone to scan this QR code in. And I'm just going to share my screen in a moment. So please do that so that we can have a little two-way interaction, which is great. So I hope you can all see that. So if you go to menti.com and enter that 8-digit number, or scan this with your QR code, scan this QR code with your phone. So I'd like to know which medical school you're at. I'm assuming most of you are at McGee, but some of you might be at Queen's or any other. Hopefully these lives, YouTube video lives are going to kind of pick up steam, and hopefully there'll be other people joining us. So about 6 out of UU and 1 out of McGee. And tell me which year you're in, if you're at UU or at McGee. I'll just give it another minute or two. Are you all struggling with the technology? I hope you're not. So about 5 in the second year and 1 in the Queen's CA. So, you know, a good mix, mostly it's an early medical course. Feel free to chip in, guys, if there's a few more of you. Don't be shy. We want to make this a bit interactive. And finally, what is the one word that comes to mind when thinking about surgery placements? And don't be rude. This is completely anonymous. I don't know who's saying what, so feel free to. Exciting, anatomy, daunting. Yeah, this is partly what this seminar is about. I would use the word, because there are a few of you saying exciting, so that's why the word is bigger. Scrubbing in, yeah, diving in, getting your hands dirty or bloody or whatever it is. Yeah, so, you know, generally kind of a fairly exciting, but so a little bit of excitement together with a little bit of anxiety, I guess. So this seminar is hopefully going to decomplexify and make it a little bit more so less intimidating and less daunting, hopefully. So let's go back to my other slides. So what is this talk about? Generally, this is going to be essentially about me basically helping a younger version of myself to make it, to cut a long story short. You know, a medical career or a surgical career can be divided broadly into 3 stages, so beginning, middle, and end, beginning, middle, or late. And you are all at the C1 stage. You haven't really done much. You are all kind of absorbing information, imbibing information. You're kind of getting used to being around hospitals and patients and so on. As you sort of become more senior and you graduate and you become a specialist, you go into the do one stage, you become a practitioner, and you actually are involved in the day-to-day sort of doctoring at the coalface. And as you sort of enter your, I don't know, so 50s, which is where I am, I'm into my early 50s, you feel the sort of the urge to, you know, send the ladder down, teach, sort of, and be helpful to other people coming up behind you. So I'm not a professor of surgery. I'm not some guru. I'm just somebody who has traveled the road you're on, and somebody who is going to sort of pass on what I have learned. And I should also add that I don't speak for the medical schools. I'm just on the internet. I just speak for myself. So I'm not a representative of those schools. I should add. But yeah, so yeah, when you come to the teaching stage, you kind of want to. I'm still a jobbing surgeon at the coalface. I'd like to think of myself currently as a sort of player coach. And as you sort of become a little bit older and you progress in your career, you tend to kind of stop working, but you never really stop learning, and you actually continue to help others. And I feel that urge, and this is what this YouTube channel is all about, and this is what this talk is about. So essentially, what a younger version of myself would have liked to have heard, you know, at the C1 stage or at the do one stage. And also, I'm a bit of a nerd. I like to get my hands involved in all sorts of new technology. I love technology, and I also love teaching. So this is like the perfect intersection, the Venn diagram of where we are at the where I am. So gives me a chance to scratch these two itches at the same time. And so by the end of this talk, I hope and I expect that you will feel a lot more in control about your surgical placement, feel a lot more confident about it, feel that it's a little bit less daunting, it's a little bit less scary. I hope and I expect that you will feel energized and excited. You will feel that I'm not some boring old boomer that droning on. I'm actually, I've got, hopefully something interesting to say that you would want to hear more from me in subsequent videos, hopefully. And also come away with 3 mindset shifts, 3 pro tips, 3 hacks, which is what everybody loves these days, about how to make your own surgical placement much more productive and much easier. So that's basically where we are. And the 3 parts of this talk, there are 3 parts of this talk. And the first one is what makes a student stand out to a surgeon. So from hearing it from my side of things, from the consultant side of things, from the medical school side of things. Part 2 is going to be what are the common questions about surgery placements that students wonder about quietly to themselves but never dare articulate or never ask. And the third part is going to be those pro tips or hacks or mindset shifts. Basically, essentially, what I would have liked to have heard myself when I was at your stage. So that's essentially where we are. Those are the 3 parts. So let's crack on with the first one. What makes a student stand out to a surgeon? What makes somebody could stand out and be memorable? Because I've been doing some teaching for students for a couple of decades, really, and there must have been thousands. But a few do stand out, and you do remember them. So what is it about them that makes them stand out? And then so can you. All of these things, by the way, are nothing. There's nothing sort of magic about them. They also all apply when you become a surgical resident doctor. When you hit the coal face and are let loose on the public, essentially, when you are doing it for real, when you're kind of progressing from the C1 stage to the Do 1 stage, and so a lot of these things are sort of universal principles that apply as you go through your career too. So the first one I would say is punctuality and reliability. I regard punctuality as basically just basic good manners, basic respect for the time of other people. So if you're attending a seminar, if you're going to the operating theater, if you are, for example, going on a date, whatever it may be, it's important to be punctual. And I have a particular thing about this myself. And reliability. So if you're given a task to do, there's a very good chance, there's a high likelihood that you will actually achieve that, and you will be, somebody can actually rely on you. Now, as a medical student, you probably don't have any responsibilities. Well, you don't have any responsibilities at all. But as you progress, you will be given tasks to do, and it's very important that you prove yourself to be reliable. Professionalism in dress and behavior. This obviously goes without saying. Professional behavior basically just means sounding more like a doctor rather than more of like a student. And again, sort of using medical terminology, being very respectful to patients and things like that. Preparedness, reading up a little bit about what you're going into, a seminar or an operating theater, knowing the cases, knowing what's coming up. If I was to summarize in one word the best attribute for a young junior doctor or a medical student, it would be being proactive. Willingness to muck in as another good one. Again, medical students kind of are sort of hovering in the background often, but if there is something going on, being willing to muck in, never watching the clock, never being sort of mindful of I've got to go and do something else. Obviously within reason, you have to sort of have a life and so on as well, but at the same time it's important to bear in mind that medicine is not a 9-to-5 job. stuff happens all the time, and you will see stuff that be willing to muck in. So that's very very useful attribute in a surgical student who wants to stand out. Respect for the team and for the patient. What that means is basically, you think, obviously for you it might be a classroom, but for the team it's actually a workplace. The doctors and the nurses in the clinic or in theater, they're actually there to do a job, and should bear that in mind. And of course, for the patient, who's the most important person that we are all there to serve. I mean, one of my pet peeves, again, is for medical students who sort of address elderly patients by their first name without sort of seeking permission beforehand to do so. Attentive observation. Let me bring myself back in here. Attentive observation just means, being present. It's a bit like when you play with a child, but play with your children, being present, not just physically, but psychologically, and being actually there and being attentive. It's very important to, and, experienced tutors, experienced teachers who have been around a long time can sense that if you're just sort of, just going through the motions, or actually you're really focused and listening. Resilience and stamina. That's very important. I think, in my view, there's just too much emphasis on mental health and all of that. I think there's been a degree of language inflation. Everything is now about mental health. I think it comes from a good place, but I think it has gone a bit too far. So you do need to be a little bit resilient. You need to be a little bit anti-fragile, and so you don't fall apart at every sort of negative feedback or potential sort of difficult issue or some adversity, which you probably will encounter certainly as a doctor. You will. Another attribute that makes good medical students stand out is having a teachable attitude. I love the word teachable. I hope I am teachable. I hope to be teachable when I'm 80. It just means being open to new experiences, being open-minded, and being curious, and being constantly like a sponge, and being able to kind of take on new ideas, not being closed-minded. In psychology, for example, this is a real thing. There are two modes of being, if I can put it that way, when it comes to new experiences. People describe it as either a discover mode or a defend mode. And discover mode just means that, again, you're teachable, you're open to new ideas, you're really keen to learn, and you're open to have your mindset shifted and changed. Whereas in defend mode, you're constantly worried, and you see a threat around every corner, and you have this sort of victim mentality. All of that is just not a very conducive attitude to getting the best out of your medical student years, and also your F1, F2, and junior doctor years. And then, of course, curiosity and thoughtfulness. Again, kind of constantly wondering, why is this happening? Why do they do what they do? Why do they do it this way and not the other way? And of course, being open to having, suggesting new ideas yourself. So those are the things that, in my views, make a good medical student stand out on a surgical attachment. And it's been my experience that most are like that, actually. Certainly the ones who are a little bit more mature. For example, graduate entry medical students who are very motivated, very curious, very teachable, very resilient, and all the rest of it. Of course, this applies to Queen students as well. Okay, let's now feel free to ask any questions in the chat if there are any. I'm monitoring it, so if there's anything, feel free to let me know. The second part is, what are the common questions that surgery students ask to themselves, but never kind of really kind of articulate, or maybe they may ask each other, but they never kind of wonder aloud about that. One common misperception is that surgeons are scary. Am I going to get barked at? Am I going to get shouted at? And this chap here is not a surgeon, he's a politician, but most people think of surgeons as an older man who kind of asks you about tricky anatomy questions. But most surgeons are fairly laid back and actually quite relaxed. But however, there is a difference on a surgical, the energy on a surgical firm, surgical attachment is slightly different. It has a slightly, I guess, more masculine energy, you know, sort of, and some people find that a bit intimidating or scary, but it doesn't need to be. And actually, I'm a big fan of women in surgery, and I always encourage my students to consider it as a career. People wonder, how do I get hands-on experience without being overly pushy? So that's a very good question. I guess, like in anything else, you should kind of strike a good balance, you know, find a happy medium between being kind of too shy and too withdrawn, but also not the other extreme either. It's having very sharp elbows and kind of being a bit too forceful and being a bit pushy. In my experience, people tend to err more, you know, students tend to err more on the side of being a bit too shy, but you really don't have to be. Certainly with me anyway, I can't obviously speak for other people, but if you are kind of in the operating theater or with a patient or in a ward round, you just feel, you know, if there's something that you feel like doing or getting involved in, just say, oh, that looks interesting, can I do that? And most people would be very open to that. So again, find the happy medium between being pushy and being too shy. So what should I revise before theatre? I guess this depends on what's coming up. Obviously, it's an emergency, then you don't know what's coming up. It just happens. But if you know the case, you know, if it's a particular operation, laparoscopic cholecystectomy, for example. I mean, Clodagh, who's in that photograph, I was doing some bedside teaching with them yesterday, in fact, and you know, just find out if the patient is going to theatre, what they're having. And again, you're very lucky these days. You can actually ask ChatGPT or Gemini or you know, Claude or whoever, and just say, look, give me the sort of 20 most important points I need to know about this particular operation before I go in. And you know, there's a famous surgical saying that if you know the anatomy and if you know the pathology, you can actually pretty much devise the operation. You can't do it, obviously, because you need to practice, but you can kind of make sense of it. You can figure it out. And so, yeah, ask ChatGPT before you go in. You're very lucky. In my day, we had to go to a library, and I'm not that old, but pick out a book from the shelf, you know, flick through it, find the right page, and you know, sort of make notes. And it was a bit of a palaver. So now you don't have that, and it's great. Another thing that students wonder sometimes to themselves, how do I make the most of ward rounds and clinics? Again, I think, that word proactive and kind of being willing to push yourself out a little bit and actually dive in. If you know the patient and you actually say something sensible about, you know, that patient, you will impress your seniors for sure. And just having a attentive observer attitude and being in discover mode. Those are the things you can get the most out of ward rounds, just being generally avid for knowledge. How do I leave a good impression and maybe get a reference later? This is very, very good point, because unfortunately, a lot of the sort of points that students used to be able to distinguish themselves have, you know, so the hierarchy has been flattened. And so to actually leave a good impression and maybe get a reference, if you want to be a surgeon especially, then you know, that's a great opportunity when you're on a surgical placement. If you do a piece of research, piece of work, you know, get a publication, things like that. What's the right theatre etiquette? A lot of students worry that they're doing something wrong or what have you. This young lady in the photograph is not a student, she's a nurse, but that kind of attentive observing, her hands are clasped in front of her, and you know, she's kind of watching and being curious, and you know, in case there's something happening, then she can maybe find the right time to ask a question. You have to obviously read the room. Usually when surgeons are chatting about their holiday and the weather and the cat and the dog, then everything is going well. It's usually when the surgeon is very quiet and attentive that you have to kind of maybe kind of not barge in at that particular point. How do I deal with long operations? I am a maxillofacial surgeon. I remember there was once an operation that started. This was a head and neck cancer case with both the resection and the reconstruction. It started around sort of 9 a.m., when the anesthetist puts the patient to sleep, and we finished the following morning at 3 a.m. So it took, I don't know, 17, 18 hours or whatever it is. And obviously, this wasn't one person operating or even one team operating. People ducked in and out, went for a cup of tea, what have you. Obviously, as medical students, nobody's expecting you to be involved to that extent. But, if you, one thing, for example, when my juniors want to assist and they're new to it, I encourage them to maybe have a nice breakfast in the morning if it's a morning list. Porridge and a banana, or wear TED stockings and things like that. And actually that applies to the next one. What should I do if I feel faint or unwell? Just, pipe up and say so. And most people are fairly reasonable. What if I see something wrong in inverted commas? Obviously, you have to be sensible and be sensitive, but sometimes things do happen. Obviously, hopefully never hear inappropriate language or see any inappropriate behavior. But speaking of something going wrong, there is a video on my YouTube channel which I'm going to plug it once or twice, maybe twice maximum, but there's a video there called "You're Taking Out the Wrong Kidney." And medical student says to surgeon, "You're taking out the wrong kidney." And this is based on a true story in the UK a few years ago, and unfortunately the patient died because the other kidney that was left behind was diseased. That was meant to be the one to take out. And there's a huge thing in medicine about in sort of surgery, especially about human factors, and that's what it's all about. So what if you see something wrong? Within reason, say so. Okay, we're more than halfway through, but I just thought we have another little bit of feedback. So again, please go back to your Menti browser or your phone that you're checking that on. So I'm finding this YouTube live useful. No, so very useful, wondering what's on the telly. So feel free to vote and don't be shy. This is all anonymous. I won't know who's voting what. If you're finding it useful, please say so, because I really welcome feedback. Yeah, so, oops. That's great. Feel free to vote. I'm really curious to know, because I'm new to all this. Yep, 3 and 2. Okay, and we'll do another feedback at the end. So the third part of this talk is going to be about the pro tips and the hacks, which I was talking to you about earlier. The first tip that I would recommend to you guys is to make sure that you follow the patient's journey. And this is very important because, surgery, obviously the operation is the sort of most intense and the most sort of involved part of the patient's journey. But there's a whole lot of steps beforehand and afterwards. So, the patient gets admitted. That takes a while. There's a few steps. There's some investigations, workup for the patient, and then the operation happens, obviously, which is the most sort of intense part. And then there's recovery, there's discharge, there's follow-up. So as much as possible, always follow the patient's journey, rather than sort of one sort of middle third of the whole journey, because that's how you learn. That's how you find out how the whole thing works and what happens to the patient. Sometimes there are complications and unexpected events and things like that, which then you kind of, again, you can learn from that as well. Obviously, you hope to avoid them, but medicine is not like a job that everything is predictable. Otherwise, it would be a bit boring, and it isn't boring. It's actually one of the most exciting careers that you could choose. But yeah, so follow the patient's journey. So, for example, at the bedside teaching that I did yesterday, it was a young lady who had abdominal pain with gallstones. She had, gallstone pancreatitis. She actually had acute cholecystitis, and she was going to theatre. And so if you see the patient on the ward, then just say, is it okay if I follow you and follow the patient? And patients are very cool with that, so they say yes, and you see, and then follow them up through their recovery and what have you. So that's how you actually learn how the journey progresses and how the patients get better and go home. The next sort of thing that I always bore in mind for myself anyway was think of your future self. I love this photograph. This is your colleagues who qualified in this summer, 2025. And again, because I was involved from the very early stages of their journey, it was lovely to see everybody, and everybody passed, which was great. And it was a bit of a faff to get this medical school off the ground, and there was no government for a period of time, and so on and so forth. And I have to say, most of these students were a delight to teach, and now there are colleagues, there are members of the profession. And the reason why I put this up is because you're going to be in that position in 2, 3, 4 years, whatever it is. And if your future self from, I don't know, 2027 or 2028 could text you or send you a WhatsApp or email you to your current self, what would they say to you? And your job at medical school is to make the job of that future self easier, more comfortable, less stressful, more competent, and so on. And so I always used to think about this when I was a student. I used to kind of think of myself as project myself forward to when you be, and for some of you it may be very difficult to imagine this, but I assure you it's closer than you think. And so think of your future self. And most of these now doctors were very hardworking, and as a result they sort of hit the ground running. So think of your future self as you go through your surgical placement, and that will make your own life a lot easier. And then the third sort of tip, which I always used myself, again, all of these are sort of a letter to my past self, i.e. kind of people like you, was never let a day go to waste. Okay, I never let a day go to waste. And a lot of you either watching now or watching as a replay, who are fee-paying students, feel this very keenly. I don't know if you've ever met any medical students from America or American medical students. They are incredibly intense. And the reason for that is partly because they're all kind of graduates, they're all mature students. They have to have done a degree beforehand, which is not the case here. But sorry, I just got a notification. Apologies. So medical students in America are very intense because they are graduates, but the other reason is because they are paying through their nose. They're paying eye-watering amounts of money to be at medical school, and they leave medical school with what is in effect a very large debt. It's in effect a big mortgage. I left medical school with about £18,000 of debt, which was pretty bad in those days, but I appreciate that it's kind of a luxury these days. So, and also the other thing with me is that I was initially a dentist. I started life as a dentist. I'm a maxillofacial surgeon. So when I was a medical student, I was also a mature student. And I used to work in dental practice as a student. I used to, one day a week, I used to go and pull wisdom teeth in a dental practice. And that's how I sort of kept myself going. And so when I attended for teaching, and in London where I trained, you have to travel a long distance usually to get to a hospital. The distances are far and wide, and you have to go through traffic, find a parking spot and what have you. And then sometimes you were told, oh, the teaching didn't happen, or the consultant was busy, or what have you. And that used to really annoy me. That used to really get up my nose. And so further to that, I never let a day go to waste. So the way I did that was I always used to go down to the A&E department. Every hospital has an A&E department. They're always busy. There are always people coming through the doors. And I used to kind of introduce myself, put on my badge or what have you and introduce myself. Obviously, I was there for a legitimate reason. And the other thing I used to do as a pro tip was I always used to find the middle grades, the registrars or the staff grades, not the juniors, the SHOs, who are running around with their hair on fire or stressed out, and also not the consultants, partly because they may or may not be there, or they may or may not be, they would be busy with other stuff. But the middle grades, who kind of run the show essentially, they were always very happy to kind of accommodate. And what I used to do, the other thing I always did was lead with, I'm here to help. I never felt entitled. And I actually was very happy to help, do whatever they asked me. So put in a Venflon, put in a catheter, take blood. I was even happy to mop the floor if they asked me, or porter a patient, all of that was fine. But the quid pro quo of that was that I always used to ask them then to sort of critique my clerking. I used to pick up a patient, and in those days it wasn't on computer, it was a piece of paper. You pick up the chart from the top of the pile, and I used to make it a rule that I never wanted to know what the patient was there for, just their presenting complaint and obviously their name. I used to go into the cubicle and clerk the patient, do a sort of 15-20 minute clerking, and then I would ask that registrar or that other A&E doctor to sort of give me feedback or to critique what I was doing. And I did that many times, and I never let a day go to waste, because time is short. And when you're on your surgical placement, if there's a sort of fallow afternoon and there's nothing happening, just go to A&E. And I sometimes even did that when it was a boring, rainy bank holiday Monday evening, and there was nothing happening. I know it's a bit sad sometimes, but I actually used to do that. Sometimes I used to go in and it was great. So you left that time energized, and so hopefully a bit more confident and a bit more competent in the skills that your future self will eventually need. Right. So I'm going to go back, I think, to the final feedback, and then I'll have a little chat, and then we'll be finished in about 5 minutes. I hope that was reasonably useful. So again, I really value feedback, guys. Can you see that? That was meh, okay, great, or wonderful. Can you go back to your thing there? So there are about 11 of you, so feel free to chip in, guys. Thank you very much. Again, I'm trying to sort of test this technology, and this is my first YouTube live, so it seems to be going all right. Feel free to chip in, guys, if you haven't done all right, if you haven't done yet. And then, just as some ideas for me for the next YouTube live, could you do more of ... What do you think would be useful? I'll give you a minute to think about that, because that takes a bit of thinking. I am going to kind of keep these going, hopefully, and sort of make them a habit. Tips on getting involved in research and how to build a portfolio. Yeah, absolutely. I'm not a researcher, I'm not an academic, but I have done some research. I did an intercalated BSc, which I would commend to you all if you're at Queen's and you're an undergraduate and you haven't done a degree already. How to make yourself stand out given the high competition ratios of surgical training. Yeah, that's a very good point. Again, a lot of people, let me bring myself back. Yeah, so again, my understanding nowadays is that everybody's just put into a computer algorithm and it just allocates people randomly, and that's not. I mean, I again, it comes from a good place, but I think it's gone too far because people are, there are some ambitious, thrusting young people who want to do well. My one tip I would say to you is I used to be very fussy and very, I used to sort of turn up my nose at publishing papers in journals which I regarded as less than stellar. I actually managed to publish 2 papers based on original research of my own, which were I was the first author, and they were in good journals. They were in high impact factor journals. But I have changed my mind about that, partly because I think the system doesn't reward that sort of. The system rewards quantity now. So, yeah. So I would encourage you to just churn out. I mean, obviously, you have to have a degree of self-respect and a minimum viable standard. But yeah. So let me read some of these now. I really enjoyed this live. Thank you for all the tips. I particularly enjoyed the commonly asked questions aspect. Thank you for that. Telling some stories of your experiences as a young surgeon. Yeah, that'll be a good. There are loads of stories. That would be a good video. Some short videos on scrubbing or discussing simple surgical skills. I actually have some videos on my channel, for example, about suturing. Yeah, that's a good idea. Really enjoyed it. Always love case-based and portrait. The patient scenario style learning, how to build portfolio, perhaps describing the different types of surgeries and suturing. Again, there's a couple of videos on suturing. Feel free to watch those and provide feedback. I'm very, very keen on because you guys are my target audience. A video on practical surgical skills. Yeah, we can do that. There's videos on how to examine the thyroid, breast examination, abdo exam, and so on and so forth. So thank you for all of those feedbacks. I really appreciate it. Right, let me go back to my and again, if you got some value out of this, I'm not very good with Instagram. I'm terrible with TikTok, which is where I gather most of you reside these days. But if you want to follow me, I will be doing some more of these lives, and I will definitely put them out. So if you want to follow me, then you can hear about them and join the next one. I'm hoping to do at least one a week because my YouTube channel has sort of lied fallow for a while, but I'm hoping to revive it and yeah, that's where I'm going to sort of spread the word. Again, YouTube is, in my view, is the biggest university in the world, which is for free. I mean, obviously, there's a lot of garbage on it as well, of course, but if you curate your feed, it is really great. I mean, I learn stuff from it all the time. Oh dear. Sorry, I think. Sorry about that. And then finally, if you want to provide me some feedback, there is a link in the description of this video, and if you go to that, and it literally takes you a minute, and then you'll get a free textbook. You'll get a free cheeky little giveaway, which is which at sort of when you submit your feedback. Again, please feel free to be as honest as you can, because I want to improve and I want to provide a good service for you guys, and so yeah. So if you go to the link in the description, it's actually called stan.store/Amine Katabchi. Provide a bit of feedback and you get a free surgical finals textbook. So thank you all very much. I think we're at the 45-minute mark. I think it's probably as good a place to call it a day. If there are any questions, feel free to pop in them in the chat, or you can find my email on the YouTube channel. As I said, I'm very, very keen to hear from you guys. And so if there are no further questions, thank you, and I'll see you on the next one.